All right, great. Thank you. All right, thank you all for joining us today. My name is Fadi Fatala. I'm the director of the Western Center for Ag Health and Safety here at UC Davis, and I'll be coordinating our seminar series today, the June seminar, and that's our last seminar for this year. Um, we'll go first over some housekeeping items just to make sure this seminar is being recorded, and it will be available on our YouTube channel after the a day or so after we complete the seminar. All participants will be muted, and you need to use the chat function to submit a question or any questions you have for the during the Q&A session at the end of the presentation. Again, like we discussed, the Spanish interpretation will be available, and you can choose either English or Spanish from the interpretation language selection below. You should have an option on your Zoom interface. Okay, and so if you're new, welcome. We're happy to have you join us. So I'll go over the mission of the Western Center for Ag Health and Safety. Is Our mission is to improve the health and safety of agricultural workers in the West through innovative research, interactive trainings, and tailored outreach. That's our mission. And I'm gonna go ahead and introduce our speaker. Um, Lena Nguyen is a PhD student in the biological systems engineering at UC Davis, and she received our students some funding from the Western Center for Ag Health and Safety, student funding to kickstart her research and initiate and pursue her dissertation research related to low back pain among agricultural workers. Lena is a graduate of our undergraduate program too, so she had both degrees. She will have both her degrees from Davis. Please welcome Lena, and then I'll give her the floor. You can share your screen now.
Looks good on your end.
Yes, go ahead.
Okay. Okay, so yeah, I want to start off by introducing myself. I'm Lena, and I'm a grad student working under Dr. Fadi Fatala in the Occupational Biomechanics Lab at the Department of Biological and Agriculture Engineering, UC Davis. And my this research will be on real-time detection of the intervertebral disc changes related to lower back pain. So I want to start off by looking at this image. So these two images are around 90 years apart, but more or less not much has changed in terms of the type of work being done. As we can see, stooping as well as other common labor-intensive tasks is still common within the agriculture sector. So much so that a lot of occupational ergonomic research is focused on how to improve these working conditions. So we can see, looking here, we can see the stoop level is around 90 degrees and even more in some cases, and it's typically sustained for long periods of time throughout the day. So just to do an overview of why all of this all comes together, the California agriculture industry is a vital economic sector for the state. It produces almost $60 billion in revenue and is a leader. The state is a leader in agricultural production amongst all the states. So it's number one, and there is a diversity of crops that are grown here. In fact, California produces almost 41% of the fruits and vegetables that are supplied for the nation. So we can see that agricultural contribution by the state is extremely important. So So some of the leading invaluable crops shown here, and these are just a few of a few of the top, I think the top 10. Um, all of these in total produced here contribute to almost 29 billion in revenue for California. And so we can see the immense economic impact that the agriculture industry has for the state. With the type of agriculture that grows in California, a lot of the crops are labor intensive. So it requires a lot of human power to grow and maintain and harvest. So there is a crucial reliance on farm workers in making the entire operation successful. However, we can see that the population of farm workers is beginning to increase in age. And so, as we can see here, the average age now is around almost 40 years. From a healthcare standpoint, this is extremely concerning. To reiterate, from this graph, you can see that the trend is only increasing throughout the year. And so there's a concern with all of the issues that come with age on top of the type of labor that is being done. So, for California, we need around almost 900,000 workers to sustain this operation. The type of work that is done is often labor intensive, so harvesting, um, growing, harvesting, doing things that require lifting, bending, and prolonged repetitive tasks. And all these factors contribute to the increased exposure to work-related musculoskeletal disorders, or WMSD. So, in fact, back pain, specifically lower back pain, is a pervasive health issue in the United States and globally. It's expected that upwards of around 65 to 80% of the population will experience at least one episode of lower back pain. And in some cases, a subset of this population will transition on to chronic lower back pain. So we see that this is a dire phenomenon that has social economic repercussions, as seen within the healthcare industry as well, that in this case incurs almost $70 billion in medical care, and also in direct costs with loss of productivity costing upwards to almost $400 billion. Furthermore, there is a detrimental impact on the individual's psychological and mental well-being, with increased levels of depression, stress, and anxiety. So we can see that lower back pain and disorder is regarded as a national and global health issue. Understanding the development of this issue can offer insight towards potential intervention. So in order to investigate the methods of detecting lower back pain, a bit of background and context on the spine and specifically the disc will be introduced in these next slides. So a lot of the back pain will occur within the lumbar region, categorized as the L1 to L5 vertebrae. And here is where all of the most of the loading will occur within the spine. So the disc is a fibrocartilage tissue that allows for motion, and it supports the load distribution on the vertebral bony structures during motion such as flexion and extension. And here we can see the little section we call the functional spinal unit, which consists of the vertebral bodies, the two vertebral bodies, and sandwiched in between is the disc, which we'll talk about later in the next slide. And here also I want to make note of is the intervertebral foramen. This houses the spinal cord that also has nerves branching out into the outer boundaries of the disc. So the disc consists of kind of three main parts here. So we have the nucleus pulposus and the annulus fibrosus, as well as the cartilage end plate. For for our interests, we're focused on the nucleus pulposus, which houses proteoglycans. And proteoglycans are important because um, they are a component that allows water to be retained in the structure. To briefly go over what proteoglycans are, they are structures that have negatively charged groups that attract ions within the matrix. As a result, it creates an osmotic pressure that induces swelling within the nucleus pulposus. And due to the swelling property, the nucleus pulposus is able to withstand loading and is able to maintain pressure during those sustained loads. So looking at this image here to the right, this is considered a healthy disc. All structures are well defined and stay within their boundaries. And you can see here that blood vessels are contained at the peripheral regions of the disc. So this is what we would like to see in a lot of people. This is the ideal state. So for this slide, I just want to focus on this section here, on the water content levels. This plays a pivotal role in maintaining the structural integrity of the disc. Healthy discs are able to maintain water content due to the presence of the proteoglycans. However, in aging and degenerated disc, water content will typically decrease, and as a result, the loading parameters will become highly imbalanced. So in this picture, I want to make note of the comparison here. So this is a healthy disc, and this is the degenerated disc. So in the degenerated disc, we can see the calcification of the two ends of the vertebral body here. And then we can also see the narrowing of the disc as well. And as this occurs, there's bulging that happens, and that bulging part of the disc can impinge on the nerve. So that also can create a lot of pain for people with injured disc or degenerated disc. So to reiterate, so what we said before, what I said before, the blood vessels are contained outside, and because the blood vessels are not coming in towards the actual tissue in the deeper parts, a lot of the nutrients and waste will have to be brought in and carried out through passive and active uh, pathways. However, when there is an imbalance, such as an accumulation of waste or the metabolic accumulation of waste or the lack of nutrients coming in, this can cause the inception of a degenerative chain reaction. So, so here are some proposed potential ways that disc degeneration can occur. So, from what was stated before, because of the fact that the IBD, the disc itself, is more or less avascular, the internal structure of the nucleus pulposus is considered a low oxygen environment and operates under anaerobic conditions. So this creates a high concentration of lactic acid and as a result, low pH. So because it's anaerobic, it requires a lot of glucose to supply energy. And if this glucose, this nutrient, isn't supplied adequately, this can actually kill the cells. And as we see, the proteoglycans will die off. Um, because the because these discs have limited ability to recover from metabolic or mechanical injury, the disc will, in general, the disc, when injured, will try to repair itself through catabolic factors and rebuild through anabolic factors. But in a state where the catabolic factors become unbalanced, so there's more catabolic factors than anabolic, this will cause the disc to go into the state of degeneration. So we'll initiate that degeneration. So we see that from here in a degenerated disc, a lot of the matrix, the extracellular matrix will contain a lot of pro-inflammatory cytokines, like catabolic enzymes, and these all contribute to the degradation of this material, the disc. And we can see from here in this image, a healthy disc, everything is contained outside the blood vessels and the nerve fibers. And here in a degenerated disc, we can see that a lot of the fibers, especially blood and the nerve fibers, are all beginning to seep inwards and moving towards the nucleus pulposus. So we can see the actual image of the different stages of the disc. So in a healthy disc, this is what you would typically see. Everything is contained, the nucleus pulposus is contained. The annulus fibrosis is also you can see the different layers here. But as it becomes damaged and degenerates, you can see that the structures themselves become disorganized. So the annulus fibrosis, there's defects, lesions, delamination, and they kind of seep into one another. So you can't really tell which region is what. So this, in comparison, you can see this is the nucleus pulposus. You can see it's gel-like and it's within this boundary versus something like this. You can't distinguish, or even here, this is completely gone here. So what happens when this occurs? So these graphs correspond to these images. So in an ideal state, the compressive load that the nucleus pulposus is able to withstand is high and even. And as we see it as it degrades, what happens is that the transfer of stress, because the nucleus pulposus is not able to withstand that stress, it will then transfer it over to the annulus fibrosis. And so there's higher stress levels on these tissues, which typically wouldn't face those type of loads in an ideal situation. And at the very end, you see complete failure. So you see that nucleus pulposus is unable to maintain those loads, and everything um, has to be sustained by the annulus fibrosis, and that, as a result, triggers almost like a positive feedback loop where everything just starts to degrade because these tissues can't withstand those loads either. So the pain pathways, the etiology of lower back pain is complex and understood to be multifactorial. Within the IBD, when the homeostasis of the cellular environment becomes disrupted, this can induce a lot of biochemical changes, encouraging degenerative pathways to occur. So we can see that these are some of the proposed theories that can affect degeneration. So we can see that catabolic and anabolic activities, the imbalance can cause degeneration, as well as pressure changes if the disc within the disc, if there are pressure changes, this can also affect the proteoglycan production. It can actually cause the proteoglycans to slow down or even stop. And then also we have oxidative stress. So that also is something we saw with the nucleus pulposus and the low pH that occurs with the accumulation of the waste, lactic acid. So all of this can initiate pain and the degeneration in pain. So I wanna note that reoccurring theories proposed as one of the main factors in the degeneration of IBD or the disc is the loss of proteoglycans, which are the large molecules seen in the disc that allows water to be retained and to allow that swelling to occur. When proteoglycans begin to degrade, they're broken into smaller fragments. So this creates a loss of osmotic pressure, resulting in different changes in the mechanical properties of the disc. And so degenerated disc contains less water and have inferior capabilities for sustained loads. So here we're going to go over some of the imaging modalities that's typically done on the spine. So we have X-rays, CT, and MRI. So X-rays and CTs are more or less the same. X-rays are widely available. They've been around for a long time. They're quick. They offer pretty good imaging of hard tissues. However, the downside is that they produce ionizing radiation. And CTs are the same thing, but they're just X-rays that they can be acquired in multiple angles and views. So here's an image of an X-ray. So we can see the spine, the vertebral body pretty well, but we can't see the soft tissue. Here is what a CT scanner looks like. Kind of looks like an MRI machine a little bit. And here is an image of the CT scans of the spine. So they look, yeah, more or less the same. And here's the MRI machine. And in the imaging for the spine, it's considered the gold standard. It's great because it's non-ionizing and it's really good at capturing soft tissue changes in details, but it has higher scan times and higher costs, as well as it may be not accessible for patients with implants. So here are images, some images of the spine using the MRI machine. And we can see that we have pretty good quality images of the soft tissue, the discs themselves. And here's a comparison of the different stages of the disc using MRI. So we can see with the healthy disc is very bright, and as it becomes damaged and it degenerates, it becomes darker and then non-existent. Yeah. So, so why is this important? So disc degeneration detection is very difficult because a lot of patients are asymptomatic in the beginning. So in the early stages, they may not have any pain, which can make detection and intervention very difficult. And usually imaging will occur when patients do experience the pain. However, this may be too late because the degeneration may be already advancing. So an alternative to this, what we're proposing is to use ultrasound. Ultrasound is pretty good because it doesn't have any ionizing radiation. It just uses sound waves. It's non-invasive, it's inexpensive, and it's portable compared to CT or MRI, and it can be used in real-time settings. A couple of the disadvantages are that it has lower resolution compared to MRI, and it also somewhat depends on the skill of the user to be able to manipulate the positioning of the transducer to acquire these images. So, why use ultrasound for monitoring and detecting these disc changes? Although the resolution is perceived to be inferior, there is potential to transform these images to be comparable to that of MRI or CT. One thing that ultrasound does have an advantage is that it can detect fluid changes and differences, and as a result, can be utilized to understand the fluctuation of disc hydration. And why disc hydration? Because hydration of disc can be used as a metric to understand disc health as it ties back to the proteoglycan contents and how everything is sustained within the disc. And also, ultrasound imaging can be used in real time to assess these changes so we can monitor patients frequently versus infrequently with options of MRI or CT. So lower back pain is socially economically detrimental, and detection is often challenging to implement. In this research, we want to utilize CT imaging to be an alternative diagnostic tool to bridge this gap. We hope to be able to offer assessments to track physiological changes without the use of the more costly and timely modalities such as MRI and CT. And how we can do this is that we can feed these images through machine learning to offer a potential way to analyze these images to discern changes that can be comparable to that of MRI. So our objective, we want to use the imaging together with the machine learning architectures to be able to make an assessment tool. And we want to start off to see if we can detect differences using phantom models and some of the animal models. And then take those images and feed it into an ML algorithm to be able to analyze those images. So these scans are from the initial setup. So these are phantom models that we made, and then we tried to see if we can detect changes based on the ratio of the water content. And here is the cervical specimen that we also tried. We did our preliminary testing. So here we wanted to see if we could validate that if ultrasound can capture the images of the spine, and it looks like we can pull out something, but we need to do further analysis on this section here. So the preliminary data. So using phantoms to model different concentration of water. So we went from 75 to 100. 75 is if from the previous slides, we saw that for when you're for older patients, it's usually around 70%. So we took a number around that area. Um, Ultrasound imaging using phantoms. So we mixed water and sodium polyacrylate to mimic water retaining characteristics. And we then proceeded to verify these images through histographic distribution of the grayscale images to determine if changes can be detected. Our next step is to acquire more images. So using more animal models to see if we can penetrate through the different tissues and record these samples. So this is the histograms of the images. So from the human eye, if you look at these scans, you might not be able to see much difference between each scanning image. However, we can see that if we put the histogram if we apply the histogram onto these images, we can see that it's able to build a characteristic profile of each condition. So you can see these changes. So from 100% to 90% water to 85%, we can see that it's starting to change. So all these are giving us kind of this characteristic idea of where each I guess the ratio of water of where it should be at in 75% water. So we can tie this all back to machine learning to be able to produce that assessment tool. So machine learning is it's very popular nowadays. It's been used a lot, and it's pretty powerful. However, it requires large data. So for our case, we need to acquire a lot of images. And in this situation, for image analysis, we would like to use convolutional neural networks due to the fact that it's a ability to be able to extract fine features as seen in this sample image. It can extract very fine features that the human eye may not be able to detect. And hopefully we can apply these images with the machine learning to offer a way to classify and identify the different stages of water hydration and water or maybe dehydration. So for our future work, we would like to collaborate with the orthopedic department to acquire MRI images to corroborate our ultrasound data and to use that to build a model that we can apply for in vivo imaging. In summary, to do a recap, lower back pain is a global health issue with upwards of 80% of the population experiencing at least one episode. It's very common in many occupational settings, and understanding the origins and progression is very complex. But monitoring can be possible through ultrasound, and we in order to verify this, we will have to continue to do further imaging to build a more robust data set, and hopefully, with that, we can apply machine learning so that we can offer results that are similar to that of MRI and CT. And so here are some of the references. And I'd like to extend my appreciation towards NIOSH and Western Center for Ag and Health and Safety for this support for the research. And if there's any questions, I'll be happy to take them.
Thank you, Lena, for the presentation. I guess we have to put the questions in the chat. I'll go ahead and start. If you, where do you foresee the technique used in agricultural settings? Like how, give me a scenario that this would be useful.
For useful for how we would apply this assessment tool.
Yeah, if once you have it past the
So
AI and ML.
So if we can fine tune the AI enough that you can take a scanner because a lot of well, I'll give you an example. Like for example, when you're driving in those driverless cars, they have the tracking abilities. So we can apply something where we can track like it doesn't require the user to have like immense knowledge. I mean, you know how to use a transducer, but if they can track the disk, we could apply that ultrasound, feed it immediately into the algorithm, and it would spit out like a data, like a number. So, for example, if the disk is considered hydrated or like in the 80% category, and then we can track it throughout the day, that disk, to see like if this person, this individual, like does a lot of stooping, and then we see that disk hydration level goes down to, let's say, 60% or even 50%. And if they're in that range that's considered critical, maybe that we need to intervene and provide another alternative type of work for this individual to do that wouldn't exacerbate the situation.
Okay, thank you. So we got another question. Uh, so how important is everyday hydration for the back? We often hear about hydration for our body, but not specific to the back.
How's everyday hydration? Can you, do you mean like, are you talking about like drinking water type of situation? Like,
Yes.
I think drinking water in general is very, it affects a lot of components in the body. But for the disc itself, I think it's a little bit complex because, well, you should drink water, but at the same time, I think there's a well, it's not a misconception, but if there's there's certain things that are happening internally within that disc, like the changes, the biochemical changes, that there's damage that occurs. Drinking water, a lot of water in that case may not circumvent the situation. So, I mean, I've seen papers where you have people, I mean, subjects in their 20s that already are experiencing disc degeneration, and they would, I mean, from an outward perspective, you would think that they would have very good disc. So there's a lot of there's a lot of environmental issues and also genetic, perhaps, that can cause discs to have, I don't know, poor poor components that make it unable to be able to maintain the health of its state. But I would say water is good, but to explain if just drinking water alone would change the whole game, it may not be as simple as that.
Thank you, Lena. Any other questions? And so, just to kind of look at the limitations of the approach, what do you see the biggest hurdle in getting to the stage where you actually have an ultrasound that we can use it on a worker to look at their disc health? What is the biggest hurdle to get to that point?
The biggest hurdle for what I'm currently experiencing, I think the biggest hurdle is the imaging, to be able to acquire good good enough images that can penetrate through and actually get a somewhat clear view of the disk. It's one of those things that because of that very problem that a lot of people avoid using ultrasound. However, I think because coupled with the fact that ultra doesn't give you great quality images, the images compared to an MRI is not as it's not as nice. But I think with ML, with machine learning, it can be a powerful tool to be able to just pick out important features that we can use as a metric to say that the disk is within the stage of hydration or in a good state of health.
Great, thank you. If there's no other questions, uh, thank you for attending, and thank you, Lena, for